And that was our Jan Crawford reporting from Washington. So let us bring in Caitlin Huey-Burns. She is a CBSN political contributor and a national political reporter for Real Clear Politics. Caitlin Huey-Burns, thank you so much for being here.
Good morning.
So we heard Senator Susan Collins say that, look, the Senate is probably going to be starting from scratch when it comes to this health care bill. Is that the general consensus?
Right. Well, the Senate is going to definitely take their time on this. Of course, they're a more deliberative body, but they also want to make sure that they have different kinds of constituencies that they have to deal with as well, right? They represent larger states. You have a lot of senators up for re-election in 2018, of course. And so I think it's going to be a longer process. Mitch McConnell is someone to really keep an eye on. He knows this chamber very well. He knows the politics of health care very well. The Senate, of course, Republicans won the majority in 2014, campaigning on repealing Obamacare, so there is that political incentive for them. But they also think that there are some things that they need to do a better job at explaining to the public.
Right.
So there's also a bit of criticism that's come out. We saw some senators criticizing the fact that the Senate's working group, this group comprised of senators are going to be looking at ways to pass this legislation, is not very diverse. There are 5 women who are Republican senators. They're not part of this working group. We all saw that image when the president received some criticism for showing the image of the House and the celebration that they were having at the Rose Garden, and you just saw a lot of older white men. There's been some criticism there too.
Exactly. That shot, of course, was kind of went viral. There were women there, of course, but they weren't featured. It was in that tight frame, which is really problematic, especially as it pertains to the kinds of changes that this bill, as it stands in the House, could make to things like pre-existing conditions. A lot of women affected by that. So what's interesting, though, is that there aren't a lot of women in Congress still, right? There are only about 20 Republicans, I think. 20 women in the Senate. They could campaign. Democrats could campaign on this in 2018 in terms of recruiting, in terms of helping with their own elections, talking about this diversity issue. But as it pertains to health care, it's not only very apparent, but you can see it in these images, and that creates some more trouble for them.
You brought up the 2018 election that everyone's sort of looking ahead to. In Major Garrett's piece, we heard that this health insurance thing is bubbling up at these town hall meetings. It's been bubbling up for a while. People are very angry. And now we're seeing ads targeting perhaps more vulnerable Republicans. And I want to play an ad. This is targeting Congresswoman Martha McSally. She's in Arizona. Her district was won by Hillary Clinton. Let's play this ad.
Congresswoman McSally just voted for a disastrous health care repeal bill opposed by the American Medical Association, AARP, and the American Cancer Society. McSally voted to raise your costs and cut coverage for millions, to let insurance companies deny affordable coverage for cancer treatment and maternity care, and charge 5 times more for people over 50. McSally voted yes, even though the bill makes coverage completely unaffordable to people with pre-existing conditions. Congresswoman McSally, how could you do this to us?
So there you are. How could you do this to us, Congressman McSally? We still have a ways to go before we get to the 2018 election. I mean, how impactful do you think these sort of ads will be? Well,
a couple of different things. First, Democrats are targeting these 23 Republicans in Clinton districts as the prime targets for when they want in their hopes to take over the House. They have to take 24 seats collectively. They're targeting these districts. A lot of them, won by a larger margin than Trump carried than Trump performed in the districts that Clinton carried. Another thing, though, to consider is that we're not exactly sure what the politics are going to be like around this bill when it comes time for voting. We do know, though, that anytime you introduce some uncertainty around health care, voters react really, viscerally, right? We saw that in 2009 and in 2010. People, anytime you're introducing a change without really explaining what you're going to get from it, it introduces a lot of problems. So Democrats are certainly trying to capitalize on this, and they also are trying to capitalize on the fact that a president in his first term tends to lose about 20 to 30 House seats anyway. So they're hoping to really capitalize on that part of it.
Lastly, Caitlin, before we let you go, I want to ask you about former Acting Attorney General Sally Yates. She's expected to testify today in front of the Senate. The president tweeted this morning, first about the Obama administration vetting and giving clearance to General Flynn. And then he also urged senators to ask Sally Yates about leaks Here are some of the tweets that he put up. General Flynn was given the highest security clearance by the Obama administration, but the fake news seldom likes talking about that. What do you make of this preemptive messaging campaign? Think he's worried?
Yeah, I think he's a little concerned. What's interesting about that tweet, the Obama administration, of course, fired General Flynn, and there are lots of questions posed to the Trump administration about why he hired someone who, as it has been made clear throughout this process, wasn't exactly vetted to the similar standards. So what he's trying to do is take this away from the investigation and look into leaks. We saw that in the other Russia investigation hearings, and we also see him trying to kind of smear, in some ways, Sally Yates as a figure of the Obama administration. Remember, she was the one who was fired by the Trump administration after she said that she would not push forward with the travel ban, defend the travel ban. And so this is someone he's going to really try to politicize in this light. But it's important to remember, too, on this committee, Lindsey Graham is in charge, is the Republican heading this committee. We'll hear her testimony today. He's been very, very interested in these possible ties to the Russia campaign, possible ties to the Trump campaign, the Russian meddling in the election. So this is someone who's not going to take those Trump tweets for granted. I think he's going to be very much paying attention to this.
One of the few Republicans that have been openly critical of Donald Trump.
Exactly.
But I wonder for Democrats who keep hoping for some kind of a smoking gun with regards to the Trump administration, that's still, they may be hoping for that, but the reality is for them, it's better to go after him on health care, on the travel ban, on those things that affect Americans' lives.
Exactly.
As opposed to
more accessible, certainly, but a testimony like this certainly keeps this issue in the news, and it definitely, we've seen, is kind of a rallying cry among the base. And when you're trying to really keep the base kind of active and motivated, these kinds of things are important, but there are still questions that they want to know. Perhaps, Sally Yates could confirm today that she did give the heads up about General Flynn, and the extent to which she was concerned about his involvement, I think, will be really key to watch. So we will get some answers here, and it depends about how much this stays in the news or if the subject changes.
Yeah, Caitlin Huey-Burns, thank you so much.
Thank you.